Why do myeloma patients lose their hair during an autologous stem cell transplant?
Stem cell transplant itself doesn't do anything to the hair, right? It's the chemotherapy that we use for conditioning, right? It's the melphalan. So what happened with the melphalan is like the melphalan is a classic chemotherapy agent, right? And these classic chemotherapy agents, what they do, they just like target the cells that divide rapidly, right? Like the cancer cells, right? Any cancer cells divide rapidly because they are growing, right? So that's where the chemotherapy does the work, right? But then the bystanders are the other cells in our body that are normal and that also divide rapidly, right? Those are the cells of the hair follicles, right? So those get affected, and that's why we have the hair loss, right? That's how it happens, right? The transplant itself, your stem cells given back to you, those don't have anything to do with that. It's just the chemotherapy.
Do most myeloma patients lose their hair during transplant?
Yes, most of the patients go through hair loss, right? It could be a very big issue for most patients. Some patients may say no to a transplant because of that, right? Because it's a very personal decision.
So hair loss is commonly experienced when patient goes through stem cell transplant. It is because of the chemotherapy melphalan. And it is the one thing that my patients focus on during their, or often question me during our stem cell transplant consultation. Sometimes I'm able to comfort them by saying it's temporary and it's going to come back. But at other times, this seems to be the big focus of our discussion, actually. So it's not something to be dismissed.
Has there been any research about the use of a cryo, cold cap to prevent hair loss in myeloma patients going through transplant?
Past in February, in the American Society of Transplant and Cellular Therapy, in the tandem meeting, there was this abstract that was presented coming from California, from Cedars-Sinai group. And then what they did, they have 30 patients. It was a small study, but still it's the first study that I have seen about it, where they use this cryo cap, right? What is this cryo cap? It's basically a cap that is attached to a circulating system that circulates either water or a gel. And this water and gel is set up at a specific temperature, right? In this study, the patients started using the cryo cap about 60 minutes before the chemotherapy was given, and then they continue using the cap for about 5 hours. That was what it was planned. In average, the patient have like close to 6 hours of wearing the cap. Of the 30 patients, none of them have significant hair loss, right? Like we usually grade hair loss to grade 1, grade 2, or so forth. None of those patients have anything that was noticeable to anybody else or based on their surveys that they have undergone chemotherapy, for example, right? So of all those 30 patients, only one patient relapsed, let's say, rapidly after transplant. This was a patient with plasma cell leukemia. This study not only includes patients with myeloma, but also include patients with amyloidosis. Most of the patients were women. However, I will say about 40% of the patients were also male. And all of them will say, about one said that they will use that technology again, if that's the case, right? And that they will recommend it.
You know, I know that there is a lot of literature in the breast oncology world where these cryocaps are used for, cooling and to prevent a hair loss over there. And it's quite successful. In the myeloma world, that has not been taken up so much. But on a case-by-case basis, I've had patients who've expressed a deep desire to preserve their hair actually during the transplant process. So I've actually, on an individual basis, have used them. In one case very successfully, and in another case not so successfully. I think we have to learn more about this on how we can actually study this in myeloma. We don't want to affect efficacy and the effectiveness of melphalan. And I think that has been a prior concern.
How does the cryo, cold cap work to prevent hair loss? Is it similar to sucking on ice during the melphalan infusion?
Another side effect that multiple myeloma patients experience during their stem cell transplant is actually mucositis, secondary to melphalan. And the way we try to alleviate that is by having patients cool their mouths by sucking on ice, lollies, or ice cream, or whatever, that will essentially cool their mouth. And I think the concept is very similar with the cryocaps at the skull as well, that you basically cause vasoconstriction, cause blood vessels to shrink, so less chemo flows there.
When we use a cryo cap or a cooling cap on the scalp, it basically reduces the blood flow to the hair follicles of the scalp. So the chemotherapy that's in the blood of the patient at that time does not get to the hair follicles, and the hair may be preserved.
Are there any concerns about the use of a cryo cooling cap?
There are concerns about like how it works, right? The way it works is like by cooling your scalp, right? The blood vessels constrain, so there is not that much exposure to the melphalan, right? So the question will be whether or not, like, do you still have active myeloma cells, not in the scalp, but in the bones, then that will be one of the questions, right? Are those patients the right candidates, right? What about like if you have a PET scan before transplant and your PET scan is negative in that area, then probably it shouldn't be a big concern, right? I think these studies are going to continue to expand. I think a more like multi-center study needs to happen, and then start looking into that, right? I only have one patient in my practice that has done this, and he arranged for this, let's say independently, right? Because this not necessarily is covered by insurance, right? I know it's covered for other cancers, like for example, breast cancer. However, in breast cancer, it hasn't shown the great effect that we have seen in these patients with myeloma, right? Where none of them has a significant loss of hair.